Hello, hello, and welcome to Local Expert Interviews. I'm here today with Richard Sinnerton of the London Upper Limb Unit, and we're going to be talking about how to find a good shoulder surgeon, which is Richard's area of expertise. So, Richard, over to you. There are hundreds of people every month who search online for a shoulder surgeon in London. If someone is looking, what three things would you recommend that they look for in a good surgeon?
Hello. There are many more surgeons available now than there used to be. In fact, there's probably 3 times more shoulder surgeons in London than 10 or 15 years ago when I started. So there are lots of people about, but there are also lots more ways of finding one and finding a good one. Obviously, social media, websites, as well as the more traditional ways of asking your GP, asking a friend or a physiotherapist or a personal trainer in the gym, somebody who's had experience of somebody who's done a good job for them. When you do track them down, I think it's important to make sure that they actually are specialists in your area. There are a lot of surgeons who will do different things, a bit of hip, a bit of knee, etc. What you really want is somebody who's spent all their career as a professional surgeon dealing with shoulders or elbows or whichever bit is your problem. I think it's also important to find a surgeon who's got a bit of experience. With experience comes wisdom, and with wisdom comes the ability to learn that not everybody needs an operation. And that's probably the third most important tip is 60 to 70% of shoulder problems get better with time, physiotherapy, injections, and sometimes just reassurance that it's nothing too serious. So you want a surgeon who isn't going to jump in and operate on everything that comes through the door. So those would be my top tips. Experience, not operating on everything, and somebody who specializes just in that area.
Oh, that's great, Richard. Thank you so much for those answers. So once someone has done their research and they've decided that they do definitely need to speak to a surgeon, if they were to come to you at your practice, what kind of experience could they expect to receive there?
Something that's perhaps a little less formal than people are used to. As you can see, I don't wear a suit and tie. I try not to hide behind a big desk. It's a frightening enough experience going to see a doctor, and you want to make that as simple and as easy a journey as you can. I think the journey should also be quite seamless. That means it's not just about me, it's the whole support system that goes with that. So when you ring me up or email me, your call will be answered, your email will be responded to. You'll get an appointment quickly and fairly close to where you are at your convenience. And after you've seen me, it's all the follow-up that goes with it. I've got access to the best radiologists in London and the best physiotherapists in London. So after surgery, or if you don't need surgery, I can make sure that you're in the best hands with people that I've worked with for a very long time who I know are going to do the best thing for you. I think it's also important to try and use language that people understand. I dread it when people come out of my consultations and go and ask the receptionist or somebody outside, what did he actually say? What operation am I having done? What's he going to do to me? So I do try very hard to use simple language. And if you look on the website, you'll see that it's couched in very simple terms so that you can understand the complexities of what we're going to try and do for you.
Great. Okay. And because of all this experience that you have, and you're part of a fantastic practice, how would you say that your practice differs from any other practices out there? Is there anything special or unique that you can offer to people?
I think one of the things that is becoming more and more important is producing results of what you do. So feedback from patients in various guises, and that can be websites like I Want Great Care or websites like My Clinical Outcomes, where you can see the results of the surgery that we've done and compare that with other people. So you can actually get a very genuine idea as to whether we're getting good results in comparison to the rest of the country. I think coming to see me, what would be special? I get patients from all across the UK, and sometimes it can be difficult to travel all the way down to London to see me. So one of the things that I do offer is an email service. So if you can send me an email with as much information as you have about your shoulder, perhaps some pictures of the x-rays or letters from your GP or physio, that can give me quite a good starting point, and I might well be able to help just through an email, or at least start the journey and guide you in the right direction.
Great. Okay. Well, thank you again for all that. And as one final point, if there are any people who are perhaps watching this today who are maybe thinking about getting in touch with you for the first time with a query, um, is there any advice that you would give to that particular person who's coming to you for the first time?
I think have another listen to this video, perhaps go to the website, and you might find a lot of your questions will be answered on there. You may even be able to diagnose your own condition, and that might give you the reassurance that it's nothing too serious or that it is something needs something doing. And then get in touch, see how you get on when you speak to our front of office staff, and obviously I'd be delighted to see you and see if I can help get you back doing your sports, back to your work, doing all the things you want to do, hopefully the easiest way possible.
Oh, that's great. Thank you, Richard. So for anyone who is watching this, if you'd like to give Richard a call, he's available on his clinic number, which is 01483 776 494. So Richard, thank you very much for your time today. I hope it's been just as useful for everyone watching as it has been for the two of us. And we hope to speak to you again soon.
Thank you. Bye-bye.
Bye.